Good day, everyone. We are the Group 1B of BN3C. I am Kate Crystal Delgado, the leader of the group, and my members are JP Casper, Robert Castel Jr., Stephanie Quaicong, K. Francis Dawis, and Pauline Marie Ibanos. Today, we will be defending our research entitled Emotional Intelligence and Quality Patient Care Among Nurses. Now, it is fair to wonder why we have chosen this particular topic to deal with, and here is the answer. Filipino nurses are globally competent in providing quality nursing care. One of the competencies that is being practiced is by communicating with patients with deep and genuine concern. The incorporation of emotional intelligence into work has an impact on fulfillment, stress, burnout, and makes a difference in promoting a positive environment, according to Ragobert 2018. As future Lasallian nurses, the researchers pursued this topic because this study can be a way of getting a deeper understanding of emotional intelligence that can lead to enhancing personal and professional relationships with patients.
For the objectives, determine the relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among Lasallian nurses. Number 1, what is the demographic profile of nurses in terms of age, sex, and years of experience? Number 2, what is the degree of emotional intelligence of nurses? Number 3, to what extent is the delivery of quality patient care among nurses? And lastly, number 4, is there a significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among Lasallian nurses?
The hypothesis statement. There is no significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among Lasallian nurses. The theoretical framework. This study will be anchored by Jean Watson's theory of human caring and Daniel Goleman's theory of emotional intelligence. Jean Watson's theory of human caring states that caring values of nurses will influence human growth and to further develop the profession, management, education, and study of nursing. Daniel Goleman's theory on emotional intelligence is a group of skills and abilities that concentrate on three capacities: self-awareness, management of relationships, and social awareness.
For the significance of the study, the results of the study may be beneficial to the following: USLS administration. The results of the study may serve as a basis to assess student nurses and their emotional intelligence as it contributes to the future success in the field of nursing. Number 2 are the clinical instructors. Findings of this study will serve as an eye-opener to the clinical instructors, which can be made basis to establish programs and trainings for student nurses that would focus on emotional intelligence and patient care. Next are the registered nurses. The results of the study will help raise awareness to the importance of emotional intelligence among nurses to provide quality patient care. Next are the patients. The results of the study will help improve patient satisfaction in receiving quality care from nurses. Next are the student nurses. This research will serve as a guide to the student nurses on how to manage and use their emotional intelligence to improve their delivery of patient care. Lastly are the future researchers. This study will serve as a guide for further studies to be conducted in the future.
Methodology. The research design used in this study is quantitative correlational design. The participants of the study were the 30 Lasallian nurses or the nursing alumni of the University of St. LaSalle who practiced their profession as a nurse. Sampling technique. The researchers used uncontrolled quota sampling. Instruments. The researchers used 2 standardized survey questionnaires, and these are the Genus Emotional Intelligence Inventory Short and 6-dimension scale of nursing performance. First is the Genus Emotional Intelligence Inventory Short, or GEISS. It is a 14-item self-assessment survey designed to measure the staff nurse's degree of emotional intelligence at work. For the validity and reliability, the mean subscale reliability for internal consistency ranges from 0.71 to 0.85. A test reliability coefficient of 0.83 was calculated over a 2-month period. Second is the 6-dimension scale of nursing performance, or SDSNP, is a 52-item self-report survey designed to evaluate the staff nurse's ability in the delivery of quality patient care. Validity and reliability. 30 questionnaires were given to the 30 participants in a pilot study. The calculated Cronbach's alpha coefficient in this study was 0.90 for SDSNP. And for the statistical treatment, statements 1, 2, and 3 will be analyzed first using descriptive statistics that shows the mean, standard deviation, and frequency distribution values in the demographic profile of nurses, the degree of emotional intelligence, and the extent of quality patient care. For statement number 4, Spearman rank order correlation will be utilized to examine if there is a significant relationship between the degree of emotional intelligence and the extent of delivery of quality patient care among Lasallian nurses.
The findings of the study shows the computed and interpreted values and reveals that the most of the participants of the study are aged 21 and 30 years old, while the least among the participants are aged 51 and above. Based on sex, there are more female nurse participants than male nurses, and the higher proportion of the participants responded to more than 10 years of experience as a nurse. The study reveals that the degree of emotional intelligence of Lasallian nurses is generally high, with a very high extent in terms of delivery of quality patient care. Based on statistical value, the researchers rejected their null hypothesis and confirms that there is a significant relationship between the degree of emotional intelligence and the extent of delivery of quality patient care among Lasallian nurses, having a positive moderate association.
Conclusion. The researchers have arrived with the following conclusions. First, Lasallian nurses have the ability to recognize how emotions drive behavior and impact people at work, both positively and negatively. These characteristics reflect emotionally stable Lasallian nurses. Second, Lasallian nurses are able to deliver very high-quality patient care. Lasallian nurses were able to interlace their empirical expertise and clinical practice to offer the highest level of patient care. And lastly, there is a significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care among Lasallian nurses, having a positive moderate association. This means the changes in the degree of emotional intelligence are associated to the changes in the level of quality patient care, however moderate. Recommendation. In view of the findings of the study, the following recommendations are proposed. The result of the study shows a significant relationship between the degree of emotional intelligence and the extent of the delivery of quality patient care. However, the relationship is moderate. Therefore, this study should be replicated to incorporate a larger sample size of registered nurses at varying hospitals to determine the consistency of the result. Hospital and school administrators and nurses should develop training that enhances emotional intelligence and be aware that emotional intelligence is one of the important key factors in delivering a high extent of quality patient care in the clinical settings.
For the acknowledgement, the researchers would like to address their deepest gratitude to the Dean of the College of Nursing, Ms. Ivy G. Adamni, for the never-ending support up until the completion of this endeavor in the middle of a pandemic. To the selected Lasallian nurses who have allotted their time and effort and for their participation and support throughout the whole study. To the panel members, Dr. Jobert P. De Los Santos, Dr. Tony Ann B. Lachica, and Ms. Mary Beth P. Diva for their judgment and evaluation that was vital to the researchers as to the improvement of the research study. To Dr. Leslie E. Young and to Dr. Shaila M. Trajera for their guidance and feedbacks all throughout the study. As we bring our research to a close, we once again thank you for allowing us to be here and hope that this presentation has given you a much clearer understanding of the relationship of emotional intelligence and quality patient care among nurses. Once again, thank you and have a great day.